So let's talk about the diabetes mellitus. So we know that in the diabetes mellitus, the patients present with the hyperglycemia, that is the elevated glucose level in the blood. Uh, but it is actually a metabolic disorder. So it is actually a chronic metabolic disorder of carbohydrate, fat, and protein. And this condition is caused due to either there is deficiency of insulin, either there is deficiency of insulin or there is peripheral resistance to insulin. Okay, and this condition is characterized by the presence of hyperglycemia. So the patient are going to have elevated glucose level in their plasma. So first, let's look into the function of the insulin. So what does normally insulin do is that it tries to decrease the blood glucose level. And how it does, by increasing the uptake of glucose by the peripheral tissues, which include your skeletal muscle and the adipose tissue. So there will be more uptake of glucose by these tissue, and in the liver also there will be increased uptake of the glucose, which it from which it will synthesize the glycogen. So there will be more glycogenesis, and it will also decrease the glycogenolysis, that is the breakdown of the glycogen, and it is also going to increase the gluconeogenesis, which is the synthesis of glucose from amino acids. And when we talk about the fat metabolism and the protein metabolism, so remember that insulin is an anabolic hormone. So if there would be, normally what it will try to do is it will increase the synthesis of triglyceride. It would increase the synthesis of triglycerides and proteins, right? So that would be the normal function of the insulin. But so if there would be a deficiency of the insulin in diabetes, so there will be increase in the glucose level in the blood. There would be more breakdown. There would be more breakdown of fats and proteins, right? So now, as I told you that the patients are going to present with the hyperglycemia, and now you understand why. So they will also present with the classical hyperglycemic symptoms. So there would be some classical symptoms that are associated. So what are these classical symptoms of the diabetes mellitus? They are first polyuria, that is your excessive urination. Now the second symptom would be your polydipsia, that is your excessive thirst. And then we talk about the third symptom, that is your polyphagia, that is your excessive hunger. Now why this person is having polyuria? You know, there is excessive urination, and when the glucose level is above a particular threshold, this glucose will start to come into the urine. Now that would increase the osmolarity of urine as well, and you know that water moves from the low osmotic pressure to high osmotic pressure, so there would be loss of water and electrolytes via urine, right? So that is why there would be excessive urination would be there, that is your polyuria. Now when we talk about the polydipsia, due to this polyuria there will be dehydration in the body, and also the osmolarity of blood is increased. So the osmolarity of blood is increased, so water will move out from the cells into the blood, right? So both of these things will cause the severe dehydration, and that would lead to stimulating the thirst centers, and the thirst centers are going to be stimulated, and that is going to lead to your polydipsia. Now, when we talk about this polyphagia, so as we all know that there will be breakdown of the fat and the protein metabolism, there would be more breakdown due to the insulin deficiency. So what is going to happen? It will create a negative energy, and that is why the person is going to feel excessive hunger. Okay, so these are the classical symptoms that I wanted to tell you about the diabetes. So now let's talk about the glucose homeostasis, how the body is able to maintain a normal, let's say a normal blood glucose level, which is about 60 to 100 milligrams. So if I, this normal value of 60 to 100 is maintained in the blood. So let us suppose that we have got this blood vessel, and let's say that there is low glucose state in our body. So there is being a low glucose. Let's say that the glucose level in the blood is dropped below 60 milligram per deciliter, low glucose level. So I'm going to represent this glucose molecule. So there, let's say that they're very less glucose molecule. So what this low glucose level is going to do, whenever there is a low glucose level in the blood vessels, it is going to stimulate. There will be stimulations of the beta alpha cells of the pancreas. So there will be this alpha cell, right? So there will be the stimulation of alpha cell of pancreas. Now, when we have the stimulation of the alpha cell of the pancreas, it is going to release an hormone that is known as your glucagon. Now, is what this glucagon does is that this glucagon is going to act on the liver and it will try to increase the glucose level. How it is going to do that? It's going to break down the glycogen that is being there in the liver, so it will cause the glycogenolysis. It will also synthesize glucose molecules from your uh, amino acid, so it will cause the gluconeogenesis. Uh, and that will help it to achieve a normal blood glucose level, and that way it would be responsible for increasing the glucose level back to the normal range, and that is how it is able to achieve normal glucose level. Normal glucose level. Now let's talk about the other condition. What happen in when there is a high glucose level? So what is going to happen when there is high glucose level? So when there will be a high glucose level, there would be, let's say, a lot of glucose molecule in your blood vessel. Now, when there will be a lot of glucose molecule in your blood vessel, it is going to stimulate a beta cell of your pancreas, right? So there will be beta cell of pancreas will be stimulated and they will secrete a hormone called as your insulin, right? So it is going to secrete this insulin, and when the insulin will be secreted, it will do what? It will act on these peripheral cells. Like, you've got this skeletal muscle, you've got this adipose tissue. So they will the insulin, because of the action of the insulin on the skeletal muscles and adipose tissue, more glucose will enter inside of these skeletal muscles from the bloodstream, right? So from the bloodstream, the glucose molecule will start entering into the adipose tissue, and also it is going to act on your liver. And what it is going to do, that it will cause the for synthesis of your glycogen. So the glucose will be taken up, let's say this is the blood vessel, so the glucose will be taken up by your liver and they will start synthesizing. That will be called as your glycogenesis, and it will inhibit the breakdown of the glycogen. So it will inhibit the glycogenolysis, also inhibit the gluconeogenesis, and in that way the blood glucose level would decrease, right? Because of the uptake by the peripheral cells and synthesis of glycogen. So we can say that again it will decrease the glucose level and achieve the normal glucose level. So what is happening in the diabetes, you can understand that if there is complete deficiency of your insulin, that could be due to the destruction of these beta cells, and mainly these beta cells are being destroyed because of your what we say is because of the autoimmune conditions. And if they will be destroyed, there will be no insulin, and when there will be no insulin, it is going to the cells will be find it difficult to take up the glucose from the blood. There will be no synthesis will be very less. There will be more breakdown of the glycogen. So that condition is going to increase the glucose, and that will lead to a lot of complications, as we are going to see later. So that is about a little bit, and I also told you that it could also be due to the peripheral resistance. So either you have the deficiency of insulin, or these cells, the insulin, they will act on these peripheral cells via receptor, and if that receptor is damaged, it is resistant to the insulin. That is what we say, there is development of peripheral resistance, which is most commonly seen in the obese people. So that is a very high risk group. So that is about the normal glucose homeostasis. Okay, now let's move on to talk about another condition that is known as a pre-diabetes. Now let's talk about the pre-diabetes. So let's say this is the normal blood glucose level and this is the diabetic glucose level. Now if the blood glucose level is more than the normal levels but less than the diabetic levels, we call this condition to be pre-diabetes. So this is something in between the normal and the diabetic level, and this increases the chance of developing diabetes. So now let's talk about the diagnostic criteria for diabetes mellitus. So there would be different tests that we could perform. So if we could perform the random plasma glucose level, in which we would basically be checking the glucose level in the plasma at any random time. So if the random plasma glucose level comes out to be more than 200, so if it's more than 200 or equal to 200 milligram per deciliter, we call that to be a diabetic range. And remember, the person should also present with uh, classical hyperglycemic symptoms, then we can diagnose that person as a diabetic condition with the diabetes mellitus. Now, for the fasting plasma glucose level, now this is the test in which the glucose level is being detected after an 8 hour of fast that we call as overnight fast. So the normal level will be less than 100 milligram per deciliter. The pre-diabetic level will be 100 to 125 milligram per deciliter, and the diabetic level will be more than or equal to 126 milligram per deciliter. Now, when we talk about this oral glucose tolerance test, when we talk about this oral glucose tolerance test, remember that this test is actually not a routine diagnostic test. This test is only performed when the fasting plasma glucose level is in the borderline range, like if it is 124, 123. So then we could perform the oral glucose tolerance test, and the second place where we use this test is in the diagnosis of your gestational diabetes mellitus, which is the diabetes during the pregnancy. And this test is performed by giving 75 grams of anhydrous glucose dissolved in water and then taking the samples after 2 hours and measuring the glucose concentration in the plasma levels. If it is less than 140 milligram per deciliter, it will be the normal. It would be pre-diabetic if it is between 140 to 199 milligram per deciliter, and it's going to be diabetic range would be more than or equal to 200, same as your random plasma glucose level. Now, another thing is there, another test is the glycosylated hemoglobin levels. Now, you know that if the glucose would be more in the blood, the percentage of the glycosylated hemoglobins is going to increase. So, if normally it's less than 7%. Now, yeah, so if it is in the range of 5.7 to 6.4%, we call that to be the pre-diabetic range. And if it is more than or equal to 6.5%, then we call this to be the diabetic range. So so now let's just talk about the WHO criteria. According to the WHO criteria, if the patient is presenting with the classical hyperglycemic symptoms, that is your polyuria, polyphagia, and polydipsia, then we just need one laboratory values in the diabetic range to confirm the diagnosis of diabetes. So if from the fasting blood glucose level or the random blood glucose level or the glycosylated hemoglobin level, if any one of the values fall in the diabetic range, we can diagnose it as a diabetes. Now if the patient is presenting without the classical hyperglycemic symptoms, then we need at least two laboratory values in the diabetic range to confirm the diagnosis of diabetes. So that's all about the diagnostic criteria.